So the conservative management or non-operative management involves physiotherapy or strengthening of the knee muscles to make the knee stable, because along with the ligaments which make your knee stable, your muscles also play a very important role in stability of the knee. So improving the strength of the muscles by doing proper physiotherapy is one of the best ways to treat ACL conservatively. Even after surgery, rehabilitation or physiotherapy has a very important role, because even if the surgery is done in the best possible manner, if the physiotherapy or rehab afterwards is not adequate, the chances of a sportsman to go back to sports is very low. However, if ACL is treated properly by surgery and with proper rehabilitation, the return to play after an ACL tear, especially after isolated ACL tears, is as high as 70 to 75%, which is very good, especially for an injury which was supposed to be a career-ending injury at one stage. So let's talk about surgery for ACL tear. The technical term for the surgery, or technical name of the surgery, is arthroscopy assisted ACL reconstruction. Let me explain what that means in lay terms. Arthroscopy assisted means that we use a device called as arthroscope or endoscope, which we insert inside the knee with the help of a keyhole incision or a small incision, and the entire surgery is done with the help of this camera inside your knee. ACL is self-explanatory. Reconstruction, as opposed to repair, means that in a repair we would stitch the torn ligament or the torn tissues back together. However, in an ACL tear, repair most of the times will not work. So what we do is something called as reconstruction. So in reconstruction, what we do is we take a graft, another tissue, and we replace your native or torn ACL with this new graft. Now, what are the choices for graft in ACL? Usually there are two main choices. One is called as an allograft, or a tissue taken from a cadaver or a dead donor, and the other option is an autograft, or that is a tissue taken from the patient himself. In India, 99% of the cases that we do are autograft, or the tissue taken from the patient. And the most common choices are either the bone patellar tendon bone, which is a ligament that is there in the front of the knee, which extends from the kneecap or the patella down to the tibia or the leg bone. So we take the central portion of this tendon, that is, and the other option, which is in fact more commonly used, is the hamstring tendons. Now you cannot see hamstring tendons on this model here, but usually there are tendons which go in the back of the knee and which are attached here in the front of the leg bone. We have 5 major hamstring muscles and tendon units, out of which we usually take 1 or 2 tendons depending on the size of the native ACL. Now what is done is we put the camera inside the knee and we drill tunnels where the attachment of the native ACL is, and we pass this new graft and fix it there in position with the help of a bio screw or a button device. Okay, let me draw it for you. This is the thigh bone and this is the leg bone. So the ACL, normal ACL, extends from the leg bone, front of the leg bone, to the back of the thigh bone like this. So what we do is we drill a tunnel in the leg bone down here and the thigh bone up here, and pass the graft in this direction, and the graft is fixed on the femur with the help of a small clip, metal clip, and on the tibia with the help of a screw here. So that forms the new ACL ligament here. Now this is a very simplistic explanation. Obviously there are various other ways of fixing ACL and different types of ACL reconstruction that you can perform. However, this is the one that is the most commonly performed. And like I said, even after the best ACL reconstruction surgery, that is not the end of treatment. Rehabilitation or physiotherapy is a very, very important part of treatment in an ACL tear, without which full or a complete recovery is virtually impossible. Thank you.